Hello and welcome to another episode of Optometry Unleashed. I'm your host, Dr. Trevor Miranda. In this episode, we're diving into one of the most prevalent vision problems around the globe. Some might call it an epidemic called myopia. It's also known as nearsightedness. And here to help guide us through this topic is Dr. Devan Trischuk. Devan's a leading expert in myopia management and a renowned voice in the eye care community. He's also a top 40 under 40 optometrist and the owner of Family Focused Eye Care, where he's made it his mission to improve the lives for young patients. Plus, Devan and I give our take on some of the most common eye care myths, on building an effective team in a large practice, and discovering your niche in the world of optometry, and much, much more. So let's get started. Welcome to the show, Devan.
Thanks a lot, Trevor.
Yeah, it's great to have you here, Devan. And, I just wanted to ask you a little bit about your why. We're asking our guests, why optometry? Why did you become an optometrist?
Yeah, I think it started as a young kid. I think a lot of optometrists end up going this route, but I ended up being a high myope myself. So I was, at the optometrist often as a young kid, and every 6 or 9 months or 12 months, I'm in there getting new glasses and always needing a little more distance and a little more distance power. I had a great optometrist as a kid, Dr. Ron Ragoza in Yorkton, Saskatchewan. He was just such a warm, friendly guy that even though, I was going to the optometrist's office for maybe not the greatest thing because my eyes kept getting worse, but my memories are all just positive of going. He was just kind of a warm guy, big smile. He'd kind of talk to you and see how school and sports are going and that type of thing. So spent a lot of time in the optometry office as a kid and just warm memories of going there. I like math and science, so it kind of fits that way as well, that optics and physics and all those types of things. So it was kind of a good fit, I guess, as I was planning out what I wanted to do as I became an adult.
When did you first get glasses, Devan, yourself?
I probably would have been age 7. So it was, kind of grade 1 or so was when I got my first pair of glasses. I think I could provide it to the podcast. You guys could put it up, but I've got a picture of myself at that age with my glasses. For some reason, I always wanted glasses like my dad, which were big, deep aviator style frames with a double bridge that both of us are kind of wearing right now, but at that time definitely weren't cool.
It's come back into
back, yeah.
Old glasses. Our dad's glasses are cool now, so that's what we're wearing right now. If you can't see us, we're wearing cool, chunky glasses. So it's cool.
Yeah, my friends would always ask me as a kid, why did you pick such big glasses? And I don't know. My dad had them, so I wanted the same ones as my dad. Yeah.
Yeah, it's interesting. That's funny, Devan, because I know when back, this is, I don't know, year 27 for me in practice, but when I started, kids would cry when I told them they need glasses, right? And now kids cry when I tell them they don't need glasses.
Yeah.
Are you finding that a little bit?
Oh, yeah. You get those kids coming in that mom and dad prompt you a bit saying they really want glasses, so kind of make sure they don't steer you the wrong way or that type of thing. But no, it's usually, you still get the odd kid who isn't too excited, but if they do need glasses, kids are usually pretty excited because they've got other kids in their class that are wearing glasses. They're not the only kid that's going to wear them. So yeah, socially it's not as big of an issue for sure.
No, and there are some kids that try to fool us, right?
Oh, yeah.
Yeah, and we call that malingering, as you know, Devan. But we've got ways, we've got tricks. Maybe a lot of our listeners don't realize we have objective means to determine if they're myopic, right, or farsighted as well. So, what's your prescription?
Yes, right. You know what? I ended up, by the time I plateaued, I was like -9 with about 150 sil. So I did end up getting laser surgery actually when I was in my mid-20s, so about 13 years ago now. You can see I'm wearing glasses again, as often happens when you're such a high myope. Things held pretty steady for a few years, but then in a couple of years I started to regress a little bit. So right now I'm like a -150 in both eyes. So still happy I had surgery. Definitely a lot less dependent on glasses than I was going in. But I kind of still now deal with some of the post-laser stuff that they had to change so much tissue when they did surgery that I get some dryness, and contact lenses I can't really wear. They don't see great through a soft contact lens. Nighttime driving isn't great, so I kind of deal with some of those issues that come along with being a high myope who's now had laser surgery. Yeah. How about yourself? I can see looking at you, that wonderful myopic appearance that you kind of get that.
That's right. Yeah, I'm about a -350, and just to give give perspective to our listeners, a -10 means that, you can really only see further than, just your hand in front of your face. And -350, you can see a little bit further out, but you definitely are not legal to drive without glasses, and you need to be able to see. I remember I got glasses in grade 8, and I was copying things down wrong from the chalkboard back in the day, and my mom would be like, "Well, why are you making mistakes all the time?" I'm like, I don't know, I just can't see it. And it took them a while to figure out that I need to go to the eye doctor. Immigrant parents, they're like, I
Oh
don't know what's
yeah.
wrong with our kid. Like, he just seems to be losing it. Nobody really put that together for a while, and that's interesting too. Sometimes we'll get a patient that hasn't been in, the parents think they see fine, and then they're really quite myopic, and maybe they slip through. Could you comment on that? When should a child come for their first eye exam, and what's a case that you've had where a patient hasn't been corrected for a while?
Between 6 and 12 months is kind of a great time for a first exam. And then usually if everything's going well, I'll see a kid at about age 3 and then age 5. So every couple years in those early years, but then through the school years, each year, kind of getting them in for routine visits. But then, yeah, depending what's going on, sometimes you need to see them more if we're talking about myopia treatment or that type of thing. Yeah, I've definitely seen kids that mom and dad bring them in at minus or age 5 or age 6. I mean, it is just, they're going to kindergarten or they're that type of thing. So mom and dad want to check things out, but that kid's a -3 or a -4 or has a bunch of SIL. And kids are adaptable, I think, as we see. They don't know that things should look better, so they just kind of live their life. But a lot of those kids, as you see them at a 3-month check or 6-month check after they get their first pair of glasses, usually mom and dad come in saying, geez, I didn't realize I had such an outgoing kid. They were, withdrawn. They keep to themselves. They couldn't see with beyond a couple feet of themselves. So they weren't confident to play with other kids, or they just sports or outdoors wasn't great because they just couldn't see beyond a few feet. So, and I guess no fault to the parents, but I think we're, as a profession, doing a better job. And even I know when I had my kids at the hospital, they gave me the handout that said we have our, the Saskatchewan Association of Optometrists little handout in there that says get your kids exam by 12 months in age 3 and age 5. So hopefully that continues to get better. I'd say I'm seeing more and more infant patients and young patients. So I think it is. I think that education is getting out there.
Yeah, it's a great point. I mean, a lot of parents might think, hey, my child doesn't need, glasses, but you can't tell. And having an early exam, even if of course the kid's not going to respond subjectively, we can tell as optometrists if that patient needs support. And a lot of the information is coming, from their eyes to their brain as they develop. So having that clarity for development's important. It's interesting, Devan, I think back on some of those developing country trips that I've been on, and you get sometimes a really high myope, somebody they walk in and they're really, seem reserved and shy. And that's a result of them not being able to see facial expressions. And they may not be, like you alluded to, they may not be introverted, but they've been forced to, not interact facially. And so many cues we get socially from people's face, and being able to look into somebody's eyes, literally, see their expressions. And so I think that's rather fascinating as well. I think it's great what you're doing is really helping mitigate some of this myopia or nearsightedness. And you mentioned something called SIL, which is astigmatism, which is another piece. Can you just explain astigmatism in 20 seconds here?
Yeah, so astigmatism, really distance near any small detail is just blurred with astigmatism, rather than the eye, the front surface, the cornea having a spherical shape. It's going to have more of an oval or kind of like a football shape. So details are just distorted and blurred. You don't see the sharp edge of something. So yeah, if someone has enough astigmatism, again, functionally, they just can't see detail, whether it's across the room or even up close. Everything's going to be blurred for them. So correcting that, yeah, just sharpens things up. And again, that's probably the development side of things too. If they can't see up close to read and learn and those types of things as a child, it can have a big impact.
Yeah, and a lot of patients have myopia, so they're nearsighted. They can see up close, can't see far away, but also associated with astigmatism, which just makes it blurry at all distances as well. So, correcting both of those is certainly impactful. I've got a patient that he always makes the same joke, Devan, every time. I don't know if you have patients like this, but he goes like,
Oh, yeah.
I might be nearsighted, but I'm not narrow-minded. That's what he said. I pretend to laugh every time because, I've heard the joke every time. So
you know it's coming, yeah.
yeah,
I don't
I
think
know
I've
it's
had a
tough.
patient tell me that joke, but yeah, you've got your ones that tell you the exact same joke and you laugh and smile. And
Yeah, it's totally true.
yeah.
That's good. That's part of the
Yeah.
cool thing about being an optometrist. We get to develop this relationship with our patients, right?
Mhm.
Not only with their eye care, but just, personality wise, and they want to interact with us and tell us stories about their lives. It's just they need to come up with new content. If any of my patients are listening, I need a new joke every time because I
New
remember the
jokes
last
or
one.
new stories or yeah.
100%. We're just going to take a brief break and hear from our sponsor. I want to take a moment to say thank you to Hoya Vision Canada, our sponsor for this episode. Hoya empowers eye care professionals to achieve their business goals through comprehensive training and regular business reviews. Super High Vision Mirio EX4 is the latest innovative anti-reflection coating that has set new industry standards for clarity and durability. Also, their award-winning myopia management lens, MyoSmart, has sold over 4 million lenses worldwide. To learn more, contact your local Hoya territory manager today and elevate your practice. And now, back to our conversation with Dr. Devan Trischuk. Okay, I just want to talk a little bit about, the evolution of myopia management and how that's changed since I graduated in 1995, So let's just take a step back and talk, what is myopia technically? How would you define myopia in a sort of a layman's way, I guess?
Yeah. So I think myopia in the past, and even like you said, kind of off the start, it is distance blur. You can usually still see up close, but things in the distance are blurry. So then you need glasses or contacts. And that's probably even up until the last few years, even last 5 years. That's kind of been your typical myopia. Even as optometrists, I think is the way we've looked at it. Myopia now, and especially when it's in these young kids that are progressing, so what we call like axial progressive myopia, where the eye is getting bigger as these young kids are growing. Really, the way I define it now is more that the eye is getting too big. So when these kids are young and growing, some growth is normal, and even in kids that don't need glasses, that eye is going to grow a little bit. But these kids that have myopia and that keep progressing, that eye just grows too fast. So as that eye gets bigger, light just isn't as in focus at the back of the eye. So that's where they're going to need glasses or contact lenses to help sharpen things up. So in my mind, progressive myopia and kind of what we're talking about with myopia management, my definition is more just an eye that's too big and it's growing too fast for us. The distance blur side of it is kind of just, a side effect of that, kind of almost switching your mindset a little bit that, okay, this eye's big, it's growing too fast. We got to slow that down. And essentially that's where myopia management kind of is what we're doing, is looking at that size of the eye and just making sure things don't go too fast. And if we can achieve that, that's where that child's prescription is going to stay stable for us. Unfortunately, we can't reverse it at this stage, but who knows, as time goes forward, maybe we can shrink an eye, or who knows what will come in the coming years. I'd be interested, Trevor, when you, like you said, you finished school in 1995, would there have been anything myopia management, or if you think back that far, or
Yeah.
probably not
Can I
much?
remember back that
Yeah,
far?
I can't recall. Yeah,
I'm not that old that my
yeah,
memory's gone, but yeah, you know
yeah.
what? It's interesting because back in the day, and you're talking about the length of the eye, what we term axial length. That wasn't something that we measured back then. And I know a lot of practitioners, the optometrists that are managing myopia, they're measuring the axial length relative to a normative database, and then also to themselves and comparing the rate of that growth. Back in the day, for me, we would just give the patient glasses and say, hey, you can see better. We wouldn't really, we'd say, hey, it's probably going to get worse as you get older. And I used to tell patients this, and I wanted your perspective, Devan, is I'd say, hey, these glasses aren't going to make your eyes worse. You just might need stronger glasses in the future. And that may not be true the case. What's your perspective?
Yeah, so in terms of, at this stage, I think we know enough that just giving a kid that's progressing just distance glasses isn't doing enough. Over the years, I think as they were trying to figure out what the heck was going on, they'd even, I know in Asian countries, the big thing was to undercorrect patients. So, if you give that person less power than they actually need, they thought, okay, is that pushing things? If you keep giving them more power, is that almost just feeding into the cycle, and that's going to make it worse? But we've actually seen that, and there's been studies done that undercorrecting really doesn't have any benefit at all. And in some of those studies, the kids that were undercorrected even went faster than the kids that got the full correction. So I know even now, I still see some adult patients that are high myopes that were probably undercorrected their whole life. They still don't want their full correction. They asked me to pull it back a little bit, and they kind of discussed it. We discussed it. Yeah, those bottom couple rows on the chart might be a little bit blurry, but they're functional. But I think psychologically for them, they still want to have that little bit of undercorrection, and you still try and tell them that you're an adult now, development's kind of finished, your eyes haven't changed. I could give you sharper vision, but they still want that little bit of undercorrection. Yeah, myopia is, the myopia management field, I think it's the last 5 years has taken off, even the last 10 years, but I think in terms of seeing, the increase in incidence, it's even the 1970s, the 1980s, it was a lot in the Asian countries that's where things were starting to take off. And even now the numbers are huge there. Some of those countries, nearly 100% of people are myopic.
But
Yeah.
reality is we have a myopia epidemic, right?
Yeah.
And as you know, and for our listeners, if you're more myopic, you have more risk of health-related, eye-related challenges later on, like retinal detachment, where the back of your eye can be thin and peel off in some cases, or macular degeneration and other things that can happen when you're more myopic. But what the heck is going on out there, Devan?
Yeah, I think it is. I think it's, the countries that have put a huge emphasis on education and I mean, that has its benefits, but I think that is, you see the Asian countries that these kids study and do a ton of near work. Those are where those numbers, even going back the last 40, 50 years where it's really taken off, but now they're at such high levels. I think that in the last, 20, 30 years in North America, Europe is, we're catching up to those numbers as well. I don't think there was maybe as much emphasis on that education and reading and studying, but that's increasing now. And I think it's only getting easier with kids just doing more near work with devices and iPads and that type of thing. That's kind of how they're spending their leisure time, whereas 30 years ago, they'd be forced to do something else. So yeah, incidence is definitely high in Asian countries, but North America, Europe is catching up, kind of the Caucasian population as well. And I think that's just kind of that shift in what we're doing as a population has changed over the years.
Yeah. And I correct me if I'm wrong, it's about being outside as well. I know we're encouraging our patients to be outside. Can you comment on that? Outside a couple hours a day, what does that have to do with anything?
Yeah, so guidelines I give my patients is time outdoors, aiming for 2 hours a day, and then less than 2 hours of near work kind of outside of their school. It's not fully understood there, getting outside. What's kind of, they've looked at, is it different wavelengths of light? Is it the dioptric field that you're having to focus at different distances versus just being right up close? It is, and those things where they play the biggest part is more in delaying onset. So it's more, most kids start out a little farsighted and they don't need glasses because they can focus through that. That's and again, going back to, when do you see kids for their first exams? I think that's where at that 12-month age 3, age 5 visit, I can make a bigger impact if I can, especially if mom and dad are nearsighted and their kids are in, and kids are fine at that age. But it's telling them then, if you guys can get your kids outside, just making sure they're not doing near work right up in their face all day and taking breaks with it. If they can make those lifestyle modifications, that's where that shift into myopia or nearsightedness is going to happen that much later. They won't go as fast. So it's kind of the preventative part of it there. The studies, once that kids become myopic, doesn't seem to make as much of a difference if they're outdoors or near work, but I think those are still good guidelines that I still give to myopic patients and those kids. And I think parents are usually happy to hear that too, if you tell their kid that, no, you can't do 5 hours of cell phone from after supper till bedtime kind of thing.
Yeah. And so if you do diagnose a myopic patient, they're nearsighted, you can introduce them to your myopia management program. And what would some of those, mitigating recommendations, prescriptions be?
Yeah, so it's nice. It's like we said, it's probably 5-10 years that the field's really taken off, but now we've got couple different contact lens options. There's daytime contact lenses, more your typical contact lens that most people are familiar with. There's also what's called orthokeratology, which is a nighttime lens that a child wears while they're sleeping.
Like
They
a
take that
retainer.
lens. Yeah, exactly. Kind of like a retainer is a perfect analogy. That the nice thing with that is kind of the quality of life. They don't require glasses or contacts through the day because that nighttime lens reshapes their cornea for them. So it corrects their vision, but also slows that progression. The last couple of years, we've had good effective glasses options come out. We're also learning lots about an eye drop called atropine that we can use. So it is nice that we've got different treatment options. Probably when I first started to dive more into myopia stuff, 8 years ago or so, it was maybe Ortho-K was our only thing we had, but it's just kind of continued to increase a number of treatments, and the effectiveness we've seen in the studies from those treatments is great. So I know there were kids that, years ago that I said, this is our option. It didn't work for the family. So we just kind of did nothing and just said, okay, here's your glasses that keep going up. Whereas now, I really don't think there's any patient situation that I can't find, a treatment that's going to work for that family situation, whether it's based on cost or what that child is, doing through their day, their lifestyle, what they kind of need. So it's pretty nice that way that there's very few, and I really don't think any situation where a progressing child can't have treatment. You can kind of figure out what you can do for them.
Yeah, in fact, I believe
Mm-hmm.
it's the standard of care is to offer some mitigating, myopia management strategies to your patient. I think, one of the differences between an independent optometrist, I love your perspective on this, but in my opinion, if you go to Costco to get your myopia management lenses, you're not necessarily getting axial length and a customized approach to that individual. I always say I have an N of one. It's that patient in my chair and it's that child that I want to help that child, not the average child. I want to help that child. So what's your thoughts on that?
Yeah, I'd agree with that. And I think that's kind of the approach we try and take is you do that assessment, you get as much information as you can, the size of the eye, the prescription, you chat with the family and get to know them, see what that kid is doing. But then you prescribe based on that and say, you know what, I think this is what gives us our best chance to be effective with all these treatments. It's really, if a kid's not going to use it, it's not going to be effective. So when you look at effectiveness, they're kind of comparable as we go between glasses, contacts, drops. But it's really, what is you as a family, are you going to make sure this kid uses? And as a child, even, what are you interested in using? And you have to use it. The more you use it, the more effective it's going to be. So that personalized approach, I think, is really important with something like this.
Great, Devin. It's really interesting to me how the body of knowledge is evolving and our recommendations evolve with that. And I think one of the things, being in practice so long for me, I tell patients, hey, it's what I know right now, but if that knowledge changes, if the studies come out, I might change my recommendations. And it was sort of, that's more important now when we have this sort of rapid change in what we understand is happening. And we've learned a lot in myopia specifically. I wanted to bring to your attention this little gadget.
Oh, yeah.
These are not my Raver glasses, but they look. This is photobiomodulation, and so for the people who are just listening to us, I was just wearing these red light glasses called the Runa light. I know in Asia, in some areas, they've studied red light and certain wavelengths as a myopia management piece. Do you want to comment on that? You know all the latest.
Yeah, so it is. It's, this last even year or so, they've saw a red light, and it's, a couple minutes a day, every day for a child has shown that eye just won't grow when they're under this red light therapy. It is. I think Asian countries, I think maybe even Australia has a device for purchase that can be purchased. I've had a few patients, just kind of being that this is my area that I enjoy, newcomers to Canada, kind of find my way to their office or to our office here. But I've had a few Asian patients that have brought their red light devices in with them and kind of showed them to me, and I kind of check them out. And there's I think a few different ones out there. But yeah, definitely, those 1-year results on those studies are showing it's effective. For me, comfort-wise, I don't think I'm there just yet. I don't think there's, I guess, maybe the standardization of, the wavelength or the intensity of the light, and they're using a laser. They, looking at some of these studies from the Asian countries, they've treated thousands and maybe 1 million patients with this, and there's just, a couple case reports of, anytime you apply light energy to the eye, especially when you're looking right at it, you worry, are you going to scar the macula or structures at the back? And unfortunately, that's not reversible. So there have been a couple case reports. So I think that people that are taking a cautious approach to this, and I would be one of them, maybe aren't jumping on board just yet. But I think it's promising. It works, which is something as easy as light therapy. I mean, if you can do that, talk about ease of accessibility. If you can have a device that a kid looks at for a few minutes a day, and that's going to slow them down in terms of progression and how quick the eye is growing. I mean, that's fantastic. I think for something like this, probably to be picked up mainstream in North America and US and Canada, that's where they'll have to be, Health Canada or FDA approved products. And I think when it gets to that point, I'll be more comfortable just because I think it is pretty rigorous in terms of safety and effectiveness and that type of thing that they're going to determine. But yeah, these initial 1 year results are promising, which is great. I think they've looked too at, even just different wavelengths of light to, just looking at purple or blue or, these different wavelengths improve things. And it's kind of a mixed bag on the results there, that some work and it's not always the same wavelength. So I think it's the jury's still out a little bit on that, of what's the perfect wavelength, what's the perfect amount of time. For me, again, if we get back to just getting outside, if you're outside more, you get every wavelength of light, just a lot more of it, just being outdoors. So for now, just go outside, and I don't think I'm at the red light there just yet with patients, but yeah.
Yeah, I mean, I'm doing it every other day for 3 minutes. This light therapy. So hopefully I can ditch my glasses fully, Devin.
That's what
you told me that.
I think like I said, I don't think we can reverse things yet, Trevor. You tell me though, if you go from 350 to 250, you let me know, and
I'll do my scientific study on just me. But all joking aside, this photobiomodulation or red light therapy, we've been using it in the dry eye and dermatology. So I think that as we evolve our knowledge on this and more studies come out, I do think it's promising and interesting. Even on the macular degeneration side, that'll be a topic for another podcast. But there's some really interesting photobiomodulation therapies that we're going to hear about. It's interesting. Can the theories of helping patients improve? Are there exercises you can offer, like what we call vision therapy? So these are improving your eye muscle coordination through training with your brain and eye coordination. Is there exercises that you've heard of that can help?
Not too much at this stage. And I'm a big vision therapy guy. I like it for a lot of patients too. We have a great vision therapy office here in Saskatoon. I think, 20 years ago in myopia, they were looking, is it more focusing up close? So you're using those accommodating muscles to bring the focus in. And then even our, Vergence muscles, is it strain there? Is it just the fact you're using them too much? So a lot of those early theories from 20, 25 years ago were, okay, if we relax that, with a progressive lens, just so that the lens is doing the focusing up close, is that going to slow things down? And unfortunately, it really wasn't that effective. You maybe saw a little bit. And I think over the last years, there's been bits and pieces about, vision therapy or binocular vision that, does it maybe improve a little bit? Sometimes you do get patients, though, that are progressing myopes, but they also have PV issues and they need vision therapy more for that reason. But I treat them pretty separate, and I don't think vision therapy is kind of the most effective thing we have right now. But like you said, things are always changing, and I think there's lots of people looking at that and doing research there to see, is there anything going on? And there probably is something, because these studies, even the early glasses studies, kids with certain BV postures or with BV characteristics, they do better with one treatment than another. They could kind of see a correlation that way, but I don't think it's well enough understood, or they haven't been able to show, okay, this exercise is going to be effective. So it's, I'd say for me right now, kind of separate areas, but who knows what comes in the future there.
Yeah, they're working on it. I know, contour prism, and this is, prism inside glasses to bend the light so your eye muscles don't have to work as hard to fixate together. They're working on studying that. So I think that's quite intriguing as well. So what are some of the craziest ideas that patients have come to you and say, hey, I'm doing this? And you're like, interesting. Any stories from there?
Yeah, in terms of myopia mainly, I'd say a few myopic ones that you get the odd parent who mom and dad are, -8s, high myopes, and unfortunately, genetics wise, their kids are destined to become myopes. It's a very low chance they won't go that way, but you see that you're watching their kids, they start to shift into myopia, and you start to talk about treatment options, and they go that route. But then you get some of these parents that take the lifestyle side of things a little too far, so they pull their kid out of piano, they don't let them read, they kind of make them, they're probably standing outside for 8 hours a day in the middle of Saskatchewan winter, bundled up, that you almost have to pull those parents back and be like, no, it's okay. We still want your child to learn and read, and they can have activities like piano, just moderation, make sure they're not, right up close with their device, that type of thing. So you get some parents that buy in a little too much, I'd say sometimes. I think the internet, you can find anything you want out there. I've had a few adult patients, and actually a friend of mine who I had to kind of just in socially be like, no, stop talking about this with me. But I found something on the internet that he was going to train his eyes to get better, that he'd slowly buy glasses, less and less power, and that would pull his eyes down. And he was like a -4 as an adult. And I said, no, that's not going to work. And I haven't talked to him in a few years, so maybe that was put a strain on our social relationship. Or he's doing great, and but
When he's like a conspiracy theorist in myopia,
a little bit, yeah. He's like, you're
don't
just trying
even
to sell.
say that around me.
Yeah, yeah.
I love
Yeah.
it. Yeah, I know. I mean, I've had some patients. I mean, maybe again, this is a West Coast thing, Devin, but they're like, okay, I meditate and that helps me see better, or I pray. And I'm like, you know what? The big guy's looking. I mean, that's fine. You pray for me too. But I'm not sure that's a scientific approach to managing their myopia like you're doing. So that is awesome that you're that you've got science behind you.
Yeah, I try and do, and that's kind of a big thing. I try and you read the parent as much, but some people want scientific articles, but you kind of always say, we've got very good evidence, very good research that show this is effective, and that's why we're choosing this, and that's why we think you should do it.
Have you been to any developing countries?
You know what? I did a few mission trips right when I was in school and then right out of school, but it's been a few years since I've done any mission trips like that recently. Yeah.
It's cool. It's been a while for me too, but I know it's so heartwarming. Like in optometry, it's pretty cool to be able to put on glasses and have an immediate impact in somebody's life. They can look across and they see glasses. My team was just in the Philippines recently, and there was this -12, so a really high myope. She couldn't see, couldn't go to school, and when they put glasses on her, it was
See their face
almost
light up and just
overwhelming. Yeah, it was like,
yeah,
am I supposed to see like this? Because,
your heart
like you
just,
say,
yeah.
that humans are adaptable and they just think that's the norm. So, we get a lot of patients that think they're not supposed to see across the street. They're not supposed to see the leaves on trees. And when you do get them to see, it's really impactful. So I've always enjoyed that, Devin, being an optometrist, be able to sort of really experience it. Sometimes, we're back in the dark room examining patients and we don't get to experience the delight of somebody, especially a young person, wearing glasses for the first time. It's so cool. I wonder what your thoughts are on that.
Mm-hmm. Yeah, no, that's probably more in the frame gallery or the glasses area as they deliver them and they put them on. I'd say the kind of the neat thing we chatted about earlier with myopia and our different treatment options, probably one pretty neat thing that I'm there for is with the orthokeratology lenses. That's a pretty neat one that you take, a -3 or -4 kid that again can see only the 2400 letter or worse, or they can't even make that biggest letter out, and you take those lenses off of them after their first night of wearing them, and they're not perfect just yet, but maybe they're down to the 2030 or 2025, and they're meeting the driving standard. That still gives me goosebumps after doing this for all those years, that you take the lenses off and the kids looking around, mom and dad have had their minds blown that, holy cow, they can see that after wearing these lenses for one night. And that's kind of, I think, part of what drew me to this area. When I started, Ortho-K was kind of our only treatment option, and I think just that positive feedback I was getting and those few patients I was doing with it in the beginning just made me want to do it more and more, just because that, as a human being, stuff like that's what feeds your soul and you feel great about. And yeah.
Yeah, 100%, 100%. It's interesting you talk about the parents, because it's it's so important to establish that trust relationship with the parent on what you're doing. I know, actually, one of my friends, she was like, I needed a second opinion because her daughter was myopic and she just couldn't believe it. She just could not believe it. And so building that trust, especially when you're talking about treatments for myopia, where they either have to put drops in or wear this retainer contact lens overnight called orthokeratology. So how do you promote compliance via the parents?
Mhm.
How do you manage that piece?
I think it is. I think I've hopefully slowly kept improving that, but I think I've kind of been refining that in the beginning with this, and especially as more treatment options were coming, I just try and, you've got your routine exam booked with that kid, you find out that diagnosis, and you just tell the parents, okay, this is what we're doing, and you're trying to fit a lot in there, and you do your best to explain, but it takes a while to explain something like this, especially when it's new and talk about different treatment options. A lot of the time they're overwhelmed. So I know that's where we've kind of, a few years ago now, we've made that change that, you have that routine exam, you present it, you've got your couple-minute elevator speech in regards to, okay, that your child is young and growing, their eyes bigger, like you saw, they're struggling with the distance vision, but I'm going to send you home with some information today that talks about it. And that's where there's great websites and just so much information and patient-centered stuff that's easy for mom and dad to look at. And then, like we said, they can go into it if they want to read specific studies, they can. But then we have everyone come back for what we call a myopia assessment at our office, that they've had, some time to digest it. They've chatted with their spouse or partner, that type of thing. They've maybe thought of some questions. So when they come back that next time, you kind of go over that, or kind of basic stuff again, but then you say, okay, so now we don't want the eye to get bigger. So these are some of our different treatment options. This is, how aggressive we need to be with your child. This is what I'm thinking we can use. Is there, do you have any questions, or do you feel like one of these treatment options is better suited? Yeah, those early years of trying to do it all at the same time, is I'd get way behind. My staff would get stressed out as I'm behind. I'd be stressed out. I'm sweating, trying to run to the next person. That this has made things a lot nicer. I think it's really just taking that time and reading that parent too. Some parents are on board right away, or again, some parents, when both parents are nearsighted, they've already learned a little bit about this just because they're so worried about their kids that they come in asking for certain treatments, and you say, yeah, let's just make sure that's suitable, and then go forward with it. But just reading each parent situation, giving them that support. If they need stuff, just send home with them so they have some time to read about it, and then call them or email them or have that follow-up appointment type of thing. Yeah, like I said, if they're not buying in and they're not compliant, it doesn't matter how good the treatment is I give them. If the kid's not using it, they're going to progress. So yeah.
You gotta treat the parent first, right? And
That's right.
Get to the kid. So, Devin, I know you're working in a large practice, 4 partners, 4 associates. You got 22 staff, and how do you get your team and trained and on the same page so you're consistent with all of optometry, but especially in myopia management, working with the family. So, how do you get the other docs and the rest of the staff on board?
Mm-hmm. Yeah, I think it applies to anything, whether it's myopia or just lens materials or glasses or booking appointments or that type of thing. I'd say the biggest thing is just communicating, regular communication, and being really intentional that you're always continuing to communicate. I know at our office, as like you said, I've got 3 other partners that we meet once a week with our office manager. We have full staff meetings every 2 weeks. And it is, you're not always doing groundbreaking stuff at every meeting, but it's just that consistency, that everyone's on the same page. I think that's been one big thing I've learned. Been a partner now, it's just over 7 years at the office, but in the beginning, a staff member would come to me and say, yeah, this is the answer. I'd tell them that, but I neglected to check with my other 3 partners to make sure we're all on the same page. So then they go ask the other partner, a slightly different question, and get a different answer, and then staff start getting confused. So I think that, like you said, consistency is so big. But I think to achieve that consistency, you got to make sure everyone's communicating with each other, and scheduling those meetings has been huge for us. And I know if I'm gone or people miss meetings for a bit, you kind of feel that loss of continuity. Yeah, so that would be a big one for me.
Yeah, that's great. And we use Slack so that we've got 5 clinics. So
Yeah.
staff can ask questions and then we can answer it for everybody, so
Hmm.
we like that openness and we have a myopia management channel, a dry eye channel
Oh,
and such.
nice.
So that's a nice communication piece for us as well. And the other little
Yeah.
tip that I have, I have a chairside assistant because I'm trying to do as little as possible and I type with two fingers. And so, having a chairside, they start to hear your shtick. They
Hmm.
listen to what you're saying and they echo that when they're communicating to patients. And so it allows me to have some of that counseling delegated to some of my team.
Hmm.
And that helps us be consistent as well. So, yeah, I wanted to. One of my previous guests, Kevin Willem, was talking about what makes it different. How do you identify a difference that's unique in your practice? And what would you say your difference maker is at Family Focused Eye Care?
Hmm. I'd say it is. I think that patient-centered approach. I mean, I'm sure everyone says, we're taking a patient-centered approach, but again, trying to just take that to the next level and just that experience of the patient being here. Yeah, whether it's, they interact with one staff or another, we want that interaction to be as consistent and then the same message that they get. Just really feeling like we're taking care of them, getting to know them as a patient, developing that relationship. So I don't want to see you once and just give you some glasses and then you're off somewhere else the next time. I want to buy into this relationship and put some time and energy into it. I'd say too, another thing again that kind of think goes along with that patient-centered care is I've got, my myopia area that I love, but we've got, dry eye, specialty lens stuff, different things like that I feel like having 8 of us is nice. That I don't think I can be an expert in every area. That we all have our niches or areas that we enjoy. That we can work with each other or refer between each other. That you need low vision, so you're going to see one of our doctors here who really enjoys that area, and they're going to give you that higher level of care. That I think is nice when you've got a big group like that. That everyone can be doing things at the highest level possible.
Yeah, you can't be the expert in everything anymore. Like I think that
No.
that idea, because optometry has become so specialized and complex in
Mm-hmm.
these niches. If you're,
Mm-hmm.
my daughter Naya, who is one of on our previous episodes, she's in second year in optometry. And what advice would you give a student that's studying optometry or a new optometrist to find their niche in optometry, whether it's dry eye or vision therapy or low
Mm-hmm.
vision? What would your recommendations be?
Yeah, I'd say just try it all if you can and see what, resonates with you and what you do enjoy. I think it's looking back on it, it's a little bit humorous and I probably was doing a poor job of all of it. But in my first couple years of working, when your schedules, yeah, there's some big gaps in there. I think I was a dry eye specialist. I was a vision therapy. I was, disease. I was trying to do all these different almost specialty areas. It is overwhelming if you're trying to stay up to date and be, the best at all of those. I got to have a lot of time and a lot of energy and not saying you can't do it, but for me, I kind of had to say, okay, this is an area that I really enjoy. It was kind of my personal story, that being young and myopic and kind of experiencing that. I also really love working with these young kids. That's kind of my funnest patients. Like getting in there and chatting with these kids, asking them how their school and sports is going, kind of laughing and joking with them. I get a lot more pleasure interacting with children than I like their parents too and their adult patients. But I was able to see that okay, yeah, this is what's bringing me joy is chatting with these kids and helping them.
It's so cool to chat with a child and really connect,
Mm-hmm.
But I know, Devin, you're a great speaker in this area of myopia management. The Myopia Summit is coming up here in
Mm-hmm.
April, and that's pretty exciting. So can you speak to, mentorship and some of the conference things that you're doing out there?
Yeah, so trying to get out there and speak and these last few years, yeah, kind of try to again just how much I enjoyed it, how much I was kind of doing in this. I realized, okay, I know a lot and I can get out there and I've enjoyed speaking. It's a little bit of a rush to get up there and speak in front of people. The Myopia Summit coming up in April looks great. It's we've got Kate Gifford coming from Australia, who's internationally probably one of the top people in myopia. So that's very cool, and I think it's maybe her first time speaking in North America or Canada for sure, but I think even North America, the first time she's been here to talk about myopia. So that's awesome. Even the other speakers we have, though, too, Jeff Wallin from the US, who's kind of the top guy there. Even in Canada, though, not to kind of toot our own horn, we've got excellent myopia people in Canada. I think it comes from the fact we've been able to get these treatment options a little bit sooner than most countries. I think it's easier to bring a myopia treatment to Canada compared to, say, the US. That I think the fact we've had these treatment options, I think we've had a lot of optometrists become interested and become really involved. That I think a lot of the areas, even internationally, or some of the most well-spoken and most knowledgeable people are Canadian. So the lineup is fantastic. That yeah, we've got a couple big international names, but even the Canadian names are people that really know their stuff. So it should be excellent, excellent in Calgary.
Yeah, that's great.
Mm-hmm.
I'm excited for that, and it is cool. Like a lot of times, you know, they'd say you have to travel 200 kilometers or 2,000 miles to be an expert. But we've got some local experts like yourself in Canada that can really help us along. What would be the key lessons you've learned along the way in myopia management? What do you
Yeah.
think is
So probably like the biggest take homes that I could give to people is start those conversations so early when that kid's an infant, when they're still farsighted. If there's other risk factors going on that, parents are myopic or they've got older siblings, get going on that lifestyle stuff. That, if you can delay that onset by a few years, the kids that go the fastest and go for the longest, those are the kids that are myopic at age 7 or 8. So if you can even push that, to age 9 or 10, genetics wise, you might not be able to stop it altogether, but maybe they plateau now by a -2 or 3, and by age 14, 15 versus going, extremely high. So I think those early conversations are important. Along those same lines, as those early conversations come when, you're seeing those kids when they're young, when they eventually do become myopic, mom and dad are just ready to go with stuff. You're not having to, okay, now we got to slowly talk about this and explain it. Mom and dad are, yeah, you talked to me about this for a few years, that when we do see that they're ready for treatment, I want it right now. It's not, kind of the hand holding that you might have to do later on. So that would be a big one. Second thing for me is treat right away. Don't wait. These kids, a 8-year-old -1, maybe 1 or 2% of them won't progress. We know from years of seeing patients, if a kid's myopic when they're young, chances are they're progressing. It's not, well, let's wait a year and see if maybe they won't change. They do. The younger the kid is, the faster they're progressing. So that next year is kind of your most important time in that child. So if you need to treat them. If you need to be aggressive and do something like combination treatment, go to that then. Don't wait if all those risk factors are there, or they've got that big eye. You're kind of saying, yeah, this is a kid who's going to go fast. There's no point in waiting. You gotta get on it right away if you can. Yeah.
Yeah, those are great tips, Devin, in terms of how to do things quickly and then sort of get on it when you see the opportunity to help somebody. And I think you hit it right on the head there. If we can slow down some of these diseases, whether it's macular degeneration, glaucoma, all of them, we can push them so far out that they really don't become a risk to somebody's vision and the health of their eyes and their vision and ultimately their enjoyment of their life. So I think you're talking about a patient, a young person who's not even myopic or doesn't necessarily need glasses, and you're talking about the early interventions to help a lifetime of good vision. So that is really cool that you have that holistic approach. When you're getting into my age group, where I'm becoming a little less myopic over time. So what's going on there? Am I
Yeah, so I think
improving?
yeah, well, it's probably because you're doing that red light every day, Trevor.
It's 100% the red light. Also, these look great out in the dance club,
Yeah, I
man.
know you're
I can't
walking
see a
around
thing,
with
but
us. Yeah,
I'm
but
cool.
you feel good. No, I think what happens there, so yeah, like we said, that eye grows mostly when we're young. Our adult years, that eye isn't growing much. It's kind of how big it is, just like your body's really not growing. Where you do it, and you see it in 40, 50, 60-year-olds, those myopes, they start to come back a little bit, that they're not needing as much distance power. And I think that's more their lens, the cornea, just that aging process of things are changing, more how light's being focused, and that they don't need as much distance power anymore. So that's not, again, that the eye's getting smaller, or they're doing crazy treatments in BC that I don't know what you guys are up to
We might
there.
be.
Yeah,
It's like a rule. If you
or
hug a tree, you
yeah,
see
then
better.
you're yeah.
I don't know.
I
We've
think
got
it's
some
more
weird things
those
going on for sure.
anatomy of your cornea, of your lens, that that's changing over time, where you're not needing as much distance.
Yeah, I want to really thank you for sharing your expertise with me and our listeners on Optometry Unleashed, Devan. And it's great. What's new and exciting for you personally? Do you have any good goals or anything exciting coming up?
Personally, for me, looking forward to spring. Things kind of calm down a little bit with kids' sports and activities, so there's a little bit of a lull that I think when I was as a young adult, I planned something every weekend and said, "Oh, I got to be doing a trip or got to be doing something." Now it's just a quiet weekend at home feels awesome. Where you just hang out
catch
with
up.
your kids and your family and go to sleep and maybe cook a meal and eat a meal together.
I love
feels
it.
pretty good.
I love to
Yeah.
see, young parents, young dads, working hard, and I'm just like, yeah, you know what? I'm empty nesting. I'm enjoying it, but it's cool. Like, it's all fun too. It goes so fast, and so really, really enjoy it. It's nice to hear your energy, and thanks for sharing your expertise, Devan, and look forward to amazing things from you in the future. And I just want to thank everybody out there listening to Optometry Unleashed. It's just a privilege to bring you these stories and the stories behind the people that are in eye care and eyewear. And so thanks for listening, and we'll see you soon on our next episode of Optometry Unleashed. Until then, take care.
Thanks a lot, Trevor. This was fun.
Thanks, Devan. Thank you for joining us on Optometry Unleashed. If you like the show or find the content we provide valuable, please hit the follow button on Spotify and Apple Podcasts. It's a great way to support our work at zero cost to you. You can also leave us a review of up to 5 stars on both Spotify and Apple Podcasts. If you have any questions for me, comments about the podcast, or guests you would like us to consider, please leave us a comment on Spotify or Apple Podcasts with your feedback. Our team reviews all the comments we receive on the show to guide us in providing better content for our listeners. And thank you again to Hoya Vision Canada for being a proud sponsor of our podcast.